Dr. Conway is here today from the Vancouver Infectious Diseases Centre. He's the president and medical director, and he specializes in the diagnosis and treatment of chronic infectious disease and related conditions, with a focus on HIV and HCV infections. Thank you for joining us, Dr. Conway.
Yes, welcome.
Pleasure to be with you. Pleasure to be here.
Right on.
Excellent.
So the first question we have for you is what is your role in the Vancouver Infectious Disease Centre?
Well, I'm an infectious disease specialist, and in particular, I'm a virologist. So I jumped from virus to virus. I came of age, let us say, with the HIV pandemic. And then when HCV treatments got a lot better, I kind of added HCV to the portfolio, and I thought that was going to be my last virus. And then next thing you know, COVID comes around. So being a specialist in virology, there was a natural fit. And given that we work in the inner city, our focus has been, as with HIV and hepatitis C, to try and make sure that the inner city vulnerable people are just not forgotten as part of the COVID pandemic. So we design and evaluate systems of care that are geared at the inner city, but we do a whole lot more than that. We're interested in the diagnosis and treatment of infectious diseases in general, viral diseases in particular, and of course, in the era of COVID.
So in your CityNews article, you mentioned that you haven't seen numbers to prove that there's been significant spread of COVID in gyms and fitness centers. Currently, the BC government has not really shared any information on this. Unlike other provinces, is the data and likely source of transmission information accessible to you as an infectious disease expert?
No, it's not. I think these are not data that our health authorities choose to share. They would be helpful, I think, to reassure us all that the decisions to keep certain places open and other places being compelled to close down, that this was based on data. Of course, if we look at different types of places where people will congregate together for extended periods of time that tend to be indoors, where there may be additional risks, such as breathing hard, singing, and the like, they may be targeted just on the basis of first principles, that that's how infections spread. But it would be useful to me, I think, to understand where some of the very stringent and effective protocols that gyms have put in place may have failed us and mandate a closing of all the gyms across the entire province for a period of time.
Why do you think BC has not been transparent with the data?
Well, I think that every week an epidemiologic summary is published. I think that there's a feeling from the point of view of the public health authorities that this is sufficient information. And I think if we could make a case that additional information would be helpful, that could possibly be considered. If I go back to last year, 100% of all restaurants were closed. And in the final analysis, it turns out that transmissions only occurred in somewhere between 1% and 2% of all restaurants across the province. It begs the question as to whether some measures could have been taken to keep those 98% open while protecting the population at the same time.
So if only 1% to 2%, or 1-2% of infections came from restaurants, where's the bulk of the transmission occurring?
Well, I should say 1% to 2% of restaurants were identified sites where infections had been transmitted. Right now, the bulk of infections are coming to us from private social events that are either too long indoors with not enough public health restrictions in place, so people aren't wearing masks, ventilation is poor, that people are allowed in that weren't part of a particular bubble. So a friend, an acquaintance, someone from the outside joins the gathering, and given the very high rate of transmission in the community, these individuals are at particular risk to be infected and to potentially transmit the infection in that setting. I think that's where we're seeing many of the cases.
Right. So back in 2021, Dr. Henry said that gyms, she actually stated in one of her press conferences that gyms were not a source of transmission. And that kind of echoes what you said in the CityNews Vancouver article, where you just don't see that data. And then it seems as though the narrative has changed, right, with Omicron. I recently had an interview with CBC Listen with with Adrian Dix, Minister of Health, and he mentioned that there's 22 months of contact tracing where gyms were transmitting, like were a source of COVID cases, right? So there seems to be a disconnect with the information that they're providing. What are your sort of thoughts on that? Whereas like one point that's fine, now all of a sudden it's not fine, and then all of a sudden they go back and say that yes, it actually was coming from gyms, but no data there to support that.
Well, look, we've been at this for 2 years. At the very beginning, shutting everything down tight while we figured things out made a lot of sense and didn't require a lot of explanation. However, at this point in time, we are counting on people to follow the rules, get vaccinated, or ask us if they have questions about vaccination so that we can get them to yes. And when we put public health measures in place after this long, we need people to listen and observe the regulations that are in place. And the best way to do that is to explain it, is to not have it feel arbitrary. Even if it isn't arbitrary, if it feels arbitrary, people don't like it. So I would challenge anyone who says, well, there's been lots of transmissions in gyms, or there have been significant transmissions. My sense has been that gyms are very safe. The regulations that were in place for months and months, capacity was limited. You needed appointments. You needed to wear a mask, except if you were actively exercising and the like. That seems to have served us well. I would like to understand what changed.
Yeah. So like anecdotally, like we have a group of gym owners that have collectively gathered together, and advocating for getting information, getting the data from the Ministry of Health. And anecdotally, all of us have not had any cases in our gyms since the start of the pandemic. So one of the questions from one of our gym owners in the collective there, his name is Jason Dar from CrossFit 604. I'm just going to read his question out for you. In 91,000 attendances and check-ins, client check-ins, they've had 0 transmissions. Okay, so 91,000 people visits in their gym since the time. So his question is this: cases are hitting record numbers, but deaths and hospitalization remains fairly stable. So why is the Public Health Authority choosing to ignore this data and show so much concern with case numbers rather than hospitalization and deaths? And since we're almost at 90% vaccination rates, and are case numbers really a cause for concern? If so, then why not close everything instead of just shutting down just gyms? So,
well, it's a very, very rich statement that he's making with lots of points. Case numbers still matter because Omicron, it may be milder, but it's not completely benign. And if the case numbers get too high, at some point it could still overwhelm our hospital symptoms, which is why we want to try and limit transmission. In terms of our vaccination rates in the community, they seem reasonably high, but still 1 in 4 British Columbians is vaccinated, is not completely vaccinated or unvaccinated. And if you exclude the 0 to 5 age group, that's still 1 in 5. So that's still about 1 million people that are out there that could transmit the virus. So that's enough to sustain community-based transmission unless we sort of intervene. Shutting down completely is what's being done in Ontario and Quebec right now. So I suppose there's a rationale for that. But my biggest concern in doing that right now is we're having enough difficulty making sure that people follow the rules as they are. If we make them stricter, my concern is that people will spend a lot of time thinking that these rules are now arbitrary and try to find ways around them and not be as effective as they could be. I think a targeted approach that is well explained to us in terms of reducing transmission, making sure we vaccinate as quickly as we can, and making sure that any specific issues related to a specific activity are addressed as quickly as possible. In terms of shutting that activity down is probably the best way to go at this time.
So in earlier this year, in April 2021, they had taken an approach where if there was 3 cases within a business, the business would be closed for 10 days, and then it was publicly posted on Fraser Health's website, for example, because we're in Fraser Health. Do you know what, would that continue to be a good approach? And do you know why they abandoned that or appeared to abandon that approach?
So that approach is based on our ability to use testing to identify and interrupt transmission networks. So that's why what you're thinking is, in a business, if there's 3 cases, there's potentially transmission occurring. If transmission is occurring, we need to interrupt it. Mm-hmm. And that was the reason to intervene in the way that they did. Right now, we wouldn't have the ability to test in as broad a way in specific locations to be able to implement a rule such as this. We're really at the level of using testing to reduce hospitalization rates. So people get tested only if they're sick and at risk of getting sicker. And everyone else, we're just recommending that they isolate on their own. So I think the approach of April 2021 would not apply to the current environment.
Mm-hmm. So for gyms, though, like, would beyond the mitigation measures that you previously mentioned, like appointments, like what we've been doing in the past, like reduced capacity, masking unless you're actively exercising, is there any other sort of mitigation measures that gyms or really any facilities can do where you have public?
Well, obviously, you would need to have a vaccination passport implementation before anyone can get in. That reduces the risk there. In terms of having reduced capacity, that would be important. Appointments do that, and you can sort of manage how many appointments you give in a particular time frame. And gyms are a little bit different than certain other activities, let's say, because they're by membership. Mm-hmm. And so you're getting members. And my understanding is that members tend to be creatures of habit. Mm-hmm. So the person who comes to exercise at 10 or 11 comes at 10 or 11. And the same to the mid-afternoon crowd, the early evening crowd, the late evening crowd. So in fact, you think of it as multiple exposures of all sorts of people, when in fact it's actually pretty targeted. It's the same people pretty much all the time. So that reduces risk in and of itself, in addition to all the measures that I think have served gyms well. I suppose one could look at things like shutting down the showers and inviting people to go home to clean up, sort of reducing that contact time. I'm not sure that changed things a lot. I'd have to look at any data that were available. But gyms can be a controlled environment.
100%.
And I think so. I think they should potentially be given a chance to prove themselves.
That's great. Yeah, 100%. So 2 days before Christmas, so the Ministry of Health and the PHO, they decided to close gyms down. And they told me in that CBC Listen interview that, or that question, that they did this so they could have some control over the numbers and reduce our social interactions in the community, right? And then you just mentioned a whole bunch of mitigating things that all gyms have been doing and proving over the course of the pandemic. But then they go ahead and they open up malls and restaurants malls and restaurants and whatnot, and you see, hundreds of people, thousands of people in the food courts and whatnot. Maybe they're masked and whatnot, but like it doesn't seem to make any sort of sense. What is your thoughts on why they decided to do the gyms to be completely shut down like that, not reduce capacity as such, and just allow like malls to be open on Boxing Day and whatnot?
Yeah, well, I think part of it is this concern that in gyms, people will be breathing harder, generating more aerosols. So that was probably the factor that was identified,
right,
as carrying a risk. It would have been nice if they had been specific about that in terms of why they singled out gyms and had given gym owners, fitness facility owners and managers the opportunity to know about this ahead of time and to potentially answer objections. I mean, not necessarily to defend, but more to explain that all of a sudden the numbers were going up. They were doubling every day. So they may have thought, we need to do something, not nothing. And this is one of the things that was picked. I mean, they committed to reevaluate the situation on January 18th, which is 2 weeks from today.
Right.
So I think that this offers a window of opportunity to right any perceived wrongs in a relatively brief time frame. An important time frame. Closing someone down for 3 to 4 weeks is not shouldn't be trivialized. Not at all.
No, there's lots of consequences to that.
I think I would use these 2 weeks to make your case.
All right. So when you say make your case, like to whom exactly? Like who would you recommend for gym owners? Because like a whole bunch of us are looking for answers. We're never provided any sort of consultation or information as to like why, we're speculating that they think it's because of the breathing thing. Whereas we've had a whole bunch of data suggesting that, well, hey, anecdotally anyway, that we don't have cases, right? And now we're being forced to shut down.
Like it's been manageable in our, we've done measures that can manage the issue throughout all the other waves.
Like it's been proven, right? So who would you recommend we go towards, like to try to like get a discussion with, right? Is it our health authorities? Is it like, what is the...
Well, not so much the health authorities. These are public health orders that come from the public health officer and the delegates of the public health officer and the health authority. So these are the decision makers. Yeah. So these are the people that need to be influenced. A few things that I would say. First is we're being told in the era of COVID that actions have consequences. So we're being told that you need to be vaccinated, and if you are unvaccinated, there are consequences. You are excluded from social gatherings, you're excluded from restaurants, you're excluded from many, many activities that are still available to the vaccinated. So you decide to be unvaccinated, there are consequences. So in the same way, it's important to make the public health authorities aware that their actions have consequences. Mm-hmm. So closing down an entire industry on a day or two's notice over the holiday period, this may have led to certain businesses just not making it. They were at the verge of not making it, and just this extra 3 to 4 weeks of being closed, lost revenue, need to pay rent, 1st of January, need to do all these things to say, your actions, when you want to protect the public health, but it's not without negative consequences. That decision led to individuals losing their livelihoods. Mm-hmm. Second is, of all the things that we've done in COVID that have helped us, gyms and physical activity have been paramount. There were some anecdotes reported today from gym members who said that they had overcome their addiction and had remained free of street drug use because they had access to their gyms. Mm-hmm. So it may be that by closing down their gyms, that some of these people will relapse, overdose, and potentially die. Mm-hmm. So that's a consequence of closing down the gyms. And for many, many people, this was their zen. This is their oasis. They go to the gym to meet with their personal trainer, to work out, to forget the world for an hour and a half, and just sort of feel good. Yeah. And you took that away from people, and you said, go and run outside. Well, it doesn't work that way. It isn't the same.
No,
those aren't equivalent behaviors, even if you could run outside. Mm-hmm. So I think that these actions have consequences. So I would go to them and say, this is what we're going to do on the morning of the 19th. We're going to reopen. We're going to make sure vaccine passports are checked thoroughly. When you tell us it's a 3-shot vaccine passport, we will implement that. We will reduce capacity in a way that is reasonable to the operation of our business and that meets your goals. What is that capacity? You tell me. We're going to re-implement appointments. It worked for many, many months. In fact, some gym members preferred it because they just had that time away. I have to go to the gym, I have an appointment. And that you will monitor, if anyone has symptoms, they're not allowed in. And that at the first sign of any cases, okay, you will commit to to reporting them and being responsible if something happens, and to work with the public health authorities. I think, the forward-looking approaches like this and saying, this is what we want to do for the 19th of January. Morning of the 19th is what we want to do. I think that would be probably the most productive approach you could take right now.
Do you think there's also a role for how they sort of limited certain activities within gyms too during this period? At one point you couldn't have high intensity group fitness classes, and then they, at different periods of time they allowed it or not allowed it. Is that also something that would play a role in this?
Well, hopefully people will be open to a discussion around that point. Mm-hmm. In terms of the generation of aerosols that may transmit viral infection. And the parallel has been in religious services and singing, as an example, that we can't have everyone in a religious environment 200 people singing at the top of their lungs at the same time. We're going to limit that. So I would view it in that context, that there's other comparables to gyms. Let's not make it about gyms. Let's make it about specific behaviors that increase risk.
Yeah, that makes sense.
A number of gym owners and ourselves, we've submitted FOI requests for data, right? The specific data that we're asking for is to show us the evidence that proves that gyms are a source of transmission and that those transmissions are increasing hospitalization rates and deaths, right? We asked for it in a whole bunch of different settings as well. So not just gyms, right? But we wanted to compare, because you had mentioned about doing comparables, right? Where things are actually coming from. What are your thoughts on if we are to obtain that data, which proves the that gyms are not a major source of transmission, but yet the Ministry of Health and the PHO have decided to close gyms, whereas those other settings perhaps may have contributed more to the hospitalization rates and deaths?
So the power and responsibilities of public health officers are quite broad. And if they can make a case that a specific activity has the potential to increase transmission, then that would be enough to generate a public health order. So it wouldn't necessarily require proof that transmissions had occurred. It would require simply a reasonable explanation as to why an increase in transmission could potentially be expected from an activity in order to issue a public health order to restrict it.
So is that even like in the absence of data to prove that statement? Because it's difficult to say that, oh, hey, something is doing something without any sort of data to prove this, right? So how can that supersede the actual numbers that they're receiving from contact tracing?
If the public health officer can make the case that there is a reasonable possibility that there could be an increased transmission by a particular activity, that would give them the justification to issue an order without there having been a demonstration of increased transmission by that activity at the time that the order is made.
Interesting.
So do you feel that they've made that justification though? Or, I mean, maybe they have, but they haven't shared it publicly?
Well, obviously their explanation is that gyms is too many people close together breathing hard on each other, essentially. So I think that the argument can be made at this time that although that may be true, in real life that didn't happen.
Right.
When gyms were allowed to stay open, and that gyms have a lot of flexibility between fully open and fully closed. And that I think gyms want to be responsible, they want to play their part, and they would be willing to impose certain restrictions for the greater good. And this is all the more important in that gyms have been a source of positive value during this era of COVID, potentially unlike any other. I'm not sure there's a good comparable as to where people have benefited from from a particular activity in the era of COVID. So not only is there a compelling reason to allow gyms to stay open on the basis that they can control transmission, but the other part of the argument is that they can stay open in order to help people cope with COVID more productively and follow all of the rules probably more diligently if they're allowed to go work out every day for an hour or 3 times a week at least.
Yeah, I mean, and that's anecdotally what our members have said. You know, for some people that live alone and they're working at home, their 1 hour a day at the gym is like the only social interaction that they may have, and it's all from like a distance. Plus, they're getting the benefit of exercise. So
yeah, I think the case can be made in a very convincing manner, and I think we have 2 weeks to make that case in terms of lobbying effectively to prevent extension of the public health order that's already in place.
Right on.
Yeah.
Well, that's very, very helpful. That last piece was very, very helpful and insightful for all of us gym owners, and just want to thank you for your time and your expertise in this. Is there anything you want to add?
No,
to
that's it. We just really appreciate your time and sharing your knowledge.
Well, I missed my gym. I just skied 8 days in a row. That allowed me to sort of keep the weight under control. And my gym, which shall remain nameless, I think was always, I felt very, very safe when it was open.
Mm-hmm.
And I saw dozens of people get turned away. Oh, I left my vaccine passport in the car. Go get it.
Mm-hmm.
I left it at home. Go get it.
Yeah.
I'm not really coughing that much. Come back when you're not coughing.
Yeah.
I mean, I felt like the people at, and sometimes they got it, the people weren't necessarily as polite as they could have been, and they stood their ground.
Mm-hmm.
And a lot of people that were inside the gym would go to the person who was arguing that they should be allowed in and invite them to sort of take a long walk around the block and come back if they're still upset.
Yeah.
So I think I felt a sense of, and the people wanted the gym to, those of us who were inside wanted this place to remain open. So we really didn't want anything to sort of, in an egregious way, take this away from us. Right. So, full transparency here, full disclosure. I miss the gym myself. I mean, and I look forward to it being open again. But this isn't about me. It's about making decisions that are, I think, in the best interest of the people of British Columbia and COVID world.
Mm-hmm.
Yeah, for sure. Exactly.